Bismillahirrahmanirrahim. Today we are going to discuss disorders of the appendix, particularly the inflammation of the appendix, appendicitis, which is a common disorder that occurs in the vermiform appendix. The appendix or vermiform appendix, because it is it has got the shape of a worm. It is actually a true diverticulum of the cecum, and embryologically it develops from the as an outpouching from the cecum. The functions of the appendix are unknown, but theoretically it is said that appendix may take part in two important functions. First, the appendix serves as a safe house for the intestinal flora, and in conditions like diarrhea, where the intestinal flora is decreased, the appendix may supply more bacteria to replenish the intestinal flora. The appendix also contains lot of lymphoid tissue in its submucosa and mucosa, so it may have some role in the immune system. The appendix anatomically is located in the right iliac fossa, and as I said, this is a true diverticulum of the cecum. The two common diseases that are seen in the appendix is the inflammation, which may be acute inflammation or acute appendicitis, which is more common and which is the most common surgical emergency of the gastrointestinal tract. Inflammation may take the form of a chronic inflammation when there are prolonged and repeated bouts of acute inflammation. It will lead to chronic inflammation. The other diseases that occurs in the appendix include various tumors, and of these the carcinoid tumors are very common. Fortunately, the carcinoid tumors in the appendix usually do not metastasize to other organs, and comparatively it is an innocent carcinoid. Now, like other gastrointestinal uh, tract organs, the appendix consists of a inner wall or the lining epithelium, which also contains the goblet mucus secreting cells. Then the second component of the mucosa is the lamina propria, which contains lymphoid tissue uh, and blood vessels as well as nerves. And the lymphoid tissue is uh, very more in the lamina propria, and it may take the form of lymphoid nodules with germinal centers. Like other gastrointestinal organs, the mucosa of the appendix dips down to form the intestinal glands or intestinal crypts, and in the submucosa, next to the mucosa, there is diffuse lymphatic tissue. Outside the submucosa, there is the muscular layer, which consists of inner circular and outer longitudinal layer, and the outermost layer is the serosa, which is found by the peritoneum. The appendix also have blood supply and uh, nervous plexuses like Meissner plexus and Manteric plexuses. Acute appendicitis, which is acute inflammation of the appendix, most commonly initiates or start when there is some obstruction of the appendicular lumen. We know that the appendix is a blind-ended tube, and sometimes a hard stool mass known as feculate may become impacted in the appendix and will cause obstruction. This is the most common cause. Less commonly, sometimes gallstones coming from the gallbladder may get stuck in the appendix and may cause obstruction. Sometimes tumors in the near vicinity may cause obstruction of the appendix, and rarely a mass of worms like pinworms may cause obstruction of the appendix. So what happens when there is obstruction? The intraluminal pressure increases. Because the mucinous secretions are continuous, and when there is no outflow, automatically these secretions, they will accumulate in the lumen of the appendix, and the appendix become enlarged and distended. Now the enlarged and distended appendix will compress the blood vessels in the wall of the appendix, and the vascular supply of the appendix become compromised, which will lead to ischemic necrosis of the cells in the wall of the appendix. Moreover, the retention of the luminal contents and stasis, it favors the growth or overgrowth of the bacteria, and there is accelerated bacterial proliferation. So all these uh, events will lead to uh, inflammation of the appendix, and as we know that, and there is exudation and edema formation, and in acute inflammation there will be infiltration of the neutrophil leukocytes. And here I want to mention that the neutrophilic infiltration occurs in all the layers, because the presence of neutrophils in the muscular layer is very important for making the diagnosis of acute appendicitis. So in this picture, we can see that the appendix is obstructed. The secretions of the mucin into the lumen of the appendix, they continue, and when there is stasis of the contents inside the lumen of the appendix become distended, enlarged, and it will stretch the veins, arteries, and nerves in the wall of the appendix, and when the blood supply becomes compromised due to excess distension and stretching of the vessels, it will lead to ischemic cell death or coagulative necrosis of the cells in the wall of the appendix initially. So what happens that the retention of the intraluminal contents will favor the growth of the bacteria or overgrowth of the various bacterial populations present inside the appendix. Now when the walls of the appendix are stretched, what happens that there is the lymphatic drainage, and the venous return is compromised, and more secretions occur into the lumen, causing it to be becoming more distended and more enlarged, and it will further favor the obstruction. Now the ischemic changes that occurs due to stretching of the blood vessels in the wall of the appendix by the distension of the intraluminal contents, they will increase the intraluminal pressure and distension so much that sometimes the excess pressure on the already necrotic wall and the cells that have undergone ischemic depth will lead to perforation. Now, morphologically, the changes uh, vary according to the stage and severity of the underlying disease. In early acute appendicitis, uh, when the appendix is examined grossly, the subserosal vessels, which are blood vessels present in the serosa, they are congested. And the neutrophil infiltration around the blood vessels or perivascular area is seen, and in acute appendicitis, the neutrophilic infiltration is seen in all the uh, layers of the wall. As I mentioned that for making the diagnosis of acute appendicitis, the presence of neutrophilic infiltration in the muscular layer is the must, because sometimes inflammatory cells may come to the appendix from the other parts of the intestine, and their presence only in the mucosa is not taken sufficient for the diagnosis of appendicitis. But in acute inflammation or acute appendicitis, the neutrophilic infiltration also occur in the muscular layers, and the presence of neutrophils in the muscularis propria or muscular layer is must for making the diagnosis of acute appendicitis. In more progressive and advanced cases, uh, the inflammation may lead to acute suppurative appendicitis, in which severe exudation occur and the picture is changed from simple inflammatory condition into suppurative appendicitis or suppurative inflammation. And sometimes, if the disease progresses, this suppurative inflammation will lead to gangrenous appendicitis. And the gangrenous appendicitis carries high risk of rupture and release of the appendicular contents into the peritoneum, resulting in suppurative peritonitis. Now, in this picture, the initial stage of inflammation, we can see the necrotic mucosa. The mucosa becomes uh, necrotic and undergo ischemic cell death, and when the lining mucosa is shed off, there may be the formation of ulcers. The blood vessels in the serosa particularly, they become congested, and the normal glistening smooth appearance of the serosa is lost. And here we can see the neutrophils that infiltrate all the layers of the uh, appendicular wall, including the muscular layer. And as I mentioned, that there are excessive lymphocytes in the submucosa of the appendix, and this is the presence of this lymphatic tissue in the appendix that theoretically it is said that appendix may have a role in the immune system. This is because of the presence of this lymphoid tissue, and the lymphoid tissue in which the many lymphocytes get together to form lymphoid aggregates, or sometimes they may be present with germinal centers. Now, to make diagnosis of the appendix, clinically it is characterized by severe pain in the right iliac fossa, and usually there is fever. Sometimes there is associated severe vomiting, and uh, all these make the sign and symptoms. And the physical examination shows the rebound tenderness. This is particularly seen in peritonitis when we press the abdomen of the patient, and if we suddenly release the hand, the patient will cry. As long as we keep the abdomen pressed, the patient doesn't suffer from severe pain. But if we release the hand, suddenly this patient will cry up severe pain, and this is known as the rebound tenderness. And it is particularly seen when there is peritonitis. And peritonitis is also, the patients of peritonitis may also show refer pain to the shoulders. We also do complete blood count, in which we will see elevated neutrophil leukocytosis up to 17,000, 20,000. The normal count of the neutrophil is up to 11,000 per milliliter. But in acute infection and acute appendicitis, the neutrophil count may raise much above, and the more above the 11,000. The C-reactive protein, which is produced by the liver, and it is the acute phase protein, it is usually examined in acute appendicitis, and the value more than 1 milligram per deciliter are indicative of acute inflammation and acute injury. We also examine the urine, because sometimes conditions like urinary tract infection, or if there is a stone in the ureter, it may cause severe pain, and this pain sometimes is mistaken for acute appendicitis. So the acute appendicitis have certain sorts of differential diagnosis, in which the uh, presence of stone in the ureter and uh, other conditions that should also be excluded to make the diagnosis of acute appendicitis. And for this reason, we need imaging techniques like X-ray, ultrasound, and computer tomography. Now, finally, the best option for treatment of the acute appendicitis is surgical removal of the appendix. And sometimes acute appendicitis may form an appendicular mass or abscess, and sometimes subphrenic abscesses are also formed, particularly when the uh, condition or the inflammation is more severe. And if the appendix ruptures, sometimes pus may accumulate there, and a local abscess is formed, uh, which are uh, which make the appendicular abscess or uh, appendicular mass. So the best treatment is the removal of the appendix, surgical removal of the appendix, known as the appendectomy. Now, coming to the tumors of the appendix, so many tumors can occur in the appendix, but the most common tumor that is seen in the appendix are the carcinoid tumors. And we know that carcinoid tumors are actually the tumors that arise from the neuroendocrine cells or enterochromaffin cells. The neuroendocrine cells are those cells that react to a nerve impulse and secrete various hormones. For example, uh, serotonin, histamine, and other peptides that have their effects on the body. And usually, in severe cases, the carcinoid tumor may lead to carcinoid syndrome, particularly if the carcinoid tumor is metastasized to the liver, or if the primary tumor occurs in the liver. Normally, the hormones secreted by the carcinoid tumors, they are carried by the portal blood to the liver, where they are metabolized and detoxified. But if the liver becomes the site of primary carcinoid tumor, or as a result of metastasis which occurs into the liver, then the liver is unable to detoxify these substances, and as a result, the blood level of these substances or hormones rise, for example, serotonin, and it will cause carcinoid syndrome, in which vasodilation, heart flushing, and diarrhea and increased bowel movements are commonly noticed. Fortunately, the carcinoid tumor of the appendix is comparatively an innocent tumor. It may spread to the mucosa and submucosa, but usually distant metastasis doesn't occur in appendicular carcinoids. And mostly the appendicular carcinoid is seen incidentally when a surgeon is doing surgery for some other reason, and sometimes when the appendix is removed surgically and we examine the removed part of the appendix, we may see the presence of carcinoid tumors. So as I mentioned that the carcinoid tumors may occur in the mucosa, and sometimes it may involve other the rest of the walls of the appendix, that we say transmural extension. But metastasis to the lymph nodes and distant metastasis in the carcinoid tumors of the appendix are rare, and therefore it is the uh, innocent carcinoid tumor. Mucocele, which is a dilated appendix and which is filled with mucin. Like appendicitis, a mucocele or dilated appendix, it may also originate due to the obstruction that causes obstruction of the appendicular lumen. And the mucocele contain lot of mucin. The mucocele may also occur as a consequence of mucinous cystadenoma. Cystadenoma is a benign tumor in which cyst-like spaces filled with mucin are formed. And sometimes the malignant tumor cystadenocarcinoma, which is the malignant counterpart of the cystadenoma, may also result in the form of mucocele or mucus distended appendix. Adenocarcinoma, which is a malignant tumor of the glandular tissue, like that occur in the stomach and the one that occur in the large intestine or colon, and comparatively rarely in the small intestine. So adenocarcinoma, which is a malignant tumor of the glandular epithelium, may also occur in the appendix. And mostly the adenocarcinoma that occur in the appendix, the clinical presentation of the patient is just like that of acute appendicitis. Thank you very much.